My name is Joe Friedman, and I'm going to be presenting Structural Shifts or Business as Usual, an ethnographic epidemiological assessment of COVID-19 related changes to the risk environment for people who inject drugs in Tijuana, Mexico. The COVID-19 pandemic disrupted the risk environment of people who inject drugs. Some positive shifts in the United States have included improved access to housing and medications for opioid use disorder, as well as reductions in policing and incarceration for drug-related infractions. New levels of drug-related harms have also been seen, most notably, perhaps, overdose deaths in the United States skyrocketing in 2020, which you can see on the right-hand side in the red line showing the number of overdose deaths per month in 2020, which reached 60% higher than 2019 at the peak. Important shifts in the risk environment for people who inject drugs are very likely to be occurring on the US-Mexico border. Tijuana was hit very hard by the pandemic, yet accurate and timely statistics describing pandemic-related impacts have proven very difficult to come by, and data are especially limited in Mexico for stigmatized public health outcomes such as substance use disorder, overdose, and HIV. In this study, we attempted to fill this data gap using a mixed methods approach. We used intensive ethnographic participant observation among people who inject drugs. This consisted of longitudinal fieldwork in harm reduction and drug consumption spaces. We also interviewed key informants, such as harm reductionists, EMTs, and physicians who worked on the front lines. The ethnographic database consisted of approximately 80 field-recorded audio interviews and hundreds of pages of field notes. All textual data was coded thematically in vivo and analyzed for emergent themes. Importantly, all names here are pseudonyms, and some unimportant details have been changed to protect participant anonymity. We also used quantitative survey methods consisting of a rapidly administered survey of about 250 people who inject drugs in Tijuana. This was a supplement to the Eloquete 4 cohort survey. And in the analysis, we triangulated findings from the interview data with direct observations and survey results. In this presentation, we're going to be discussing the story of Johnny, who is a late 40s, tall, gregarious Chicano man who was deported from the United States a number of years prior for his use of drugs. However, it's important to note that the ethnographic population represented in this work is majority male, deported from the United States, Hep C positive, experiencing homelessness, or marginally housed. Most earn money cleaning cars on the street, sweeping, selling services or goods, quote, on the line, in the long line of cars waiting to cross into the United States, or remittances from relatives in the US. Many have spouses, children, or other family members in the United States. Field note excerpt. As Johnny and I step out into the sun, we hear the screech of braking tires, and in an instant we are surrounded. As our eyes adjust, 4 police officers and 2 soldiers come into view. Put your hands on the car, they tell Johnny, quite unnecessarily, as 2 officers are already pushing his chest onto the hood of their militarized pickup truck. The plasma TV that Johnny had been carrying on one shoulder was in the arms of a 3rd officer. A 4th has his hand on my back and is somewhat more gently pushing me against the concrete outer wall of the rundown apartments where Johnny and 36 other people who inject heroin are staying in crowded quarters. The 2 soldiers stand by silently, peering at us from over their machine guns. Are you selling him drugs? A heavy-set cop barks into Johnny's face on the hood of the car, pointing at me. No, he's a doctor, Johnny struggles to answer. The officer looks me over, trying to decide if I fit the profile of one of the gringo volunteers who frequent the numerous clinics and religious organizations in the area, or if I'm actually a drug tourist being connected by Johnny. Do you recognize him? One of the cops asks his colleagues. Yeah, I've seen him at the clinic, responds one of the other officers. Okay, you're good then. The officer stops rifling through Johnny's pockets, and all of a sudden the encounter takes on a tone of insincere respect. The officers make a big show of carefully handing Johnny the TV he had been carrying and wishing us a good afternoon. and we walk away quickly. Shit, man, we got lucky. Johnny laughs once we are half a block away. I can't believe they didn't take the TV. The kind of routinized police harassment in the anecdote is unfortunately extremely common, as is physical and sexual violence, extortion, and short-term incarceration for people who inject drugs in Tijuana. And these practices have been linked to HIV and other health risks in a robust literature. It's also known that these practices disproportionately affect more vulnerable people who inject drugs. Remarkably, during April and May of 2020, police ended these practices almost entirely. The main police base in close to the Zona Norte neighborhood where the ethnography occurred actually had the front door boarded up. Most people who inject drugs in the scene reported that it had been months since they were incarcerated. Unfortunately, after a few months, police did return to the streets with a renewed vigor, and reports of beatings, solicitation of bribes, incarceration, and informal forced abstinence-based addiction treatment quickly followed. And ultimately, 57.4% of people who inject drugs actually felt that by July through September, that police violence had actually worsened during the pandemic. And notably, the lowest income respondents, who make an average of less than $5 a day, were especially likely to report that police violence worsened, with a risk ratio of about 2.1. That said, this was the first time that, for example, Johnny could ever remember going months without being incarcerated, and in some sense, this was an experiment with ending routine policing, just as the abolition movement was gaining newfound prominence. It's about 1 p.m. on a Monday afternoon before the pandemic, and Anna, Johnny's sister, comes running up the street to where I'm standing outside the harm reduction clinic. Hey, come on, man. Johnny needs you guys. He's real sick. He's been peeing blood all weekend. I follow Anna for a few blocks, and we find Johnny in a particularly rundown store, sitting in a broken white plastic chair, looking miserable. Johnny confirms that he started peeing blood on Saturday night. Since the harm reduction clinic was closed, he tried to go to the Tijuana General Hospital, but he got turned away. Shit, man, I didn't even make it inside. The security guard took one look at me and told me to get lost unless I had an ID. A little blood coming out of your dick ain't enough to get you in there. Johnny laughs bitterly. Normally charismatic and gregarious, Johnny is depressed, in pain, and dope sick, with his ability to work and hustle compromised. He's clearly anxious to try to find heroin, but I convince him that first we need to go see one of the doctors at the harm reduction clinic. Despite excessive swelling in his lower legs, he manages to limp his way a few blocks to the clinic. Within 5 minutes, the American volunteer physician asks for an Uber to take Johnny to the hospital because he urgently needs labs and inpatient medical care. It's her first week at the clinic, and she is astounded to hear that the hospital already turned him away. Johnny also makes it clear that he's not going back to the hospital unless someone can give him methadone to stave off the withdrawal symptoms that are already gnawing at him. Slowly, Johnny and the Mexican clinic staff convince her that, although it's not ideal, and it's uncomfortable for her sense of professional obligation, the best option is for her to just treat Johnny as best as she can in the harm reduction clinic. She gives him a 10-day course of oral medications and a prepaid voucher to get some tests done at a nearby lab. It's extremely important that you go first thing tomorrow to get these tests done, she tells him. Now, very dope sick and agitated, Johnny limps off, and I'm worried that he's just going to go right back into the alley to drown his sorrows in heroin and totally forget about his medical situation. Hopefully, he will at least take the meds and they will help. Despite ostensibly universal healthcare for the poor in Mexico, in practice, low-income people who inject drugs struggle to access even basic life-saving treatment, even before the COVID-19 pandemic. Johnny's access to hospital care was structurally limited by intersecting factors such as stigma, lack of opioids in the hospital system to manage his withdrawal symptoms, distrust of doctors, and extremely underfunded and crowded public hospitals. And unfortunately, in practice, people who inject drugs are routinely turned away from hospitals, even with life-threatening conditions, by untrained security guards or overworked interns. Carla, another volunteer, and I are in front of the harm reduction clinic wearing N95 respirators and plastic face shields. The clinic is only open 3 days a week now, and the flow of people coming to exchange syringes is slower than usual. Anna runs past, and I ask her about how Johnny is doing. Not good, man. He's in rough shape. He wants to come talk to you guys, but he can't even walk because his feet are all messed up. Carla and I find an old wheelchair, and we head to the alley a few blocks away where Johnny and a few dozen other people who inject drugs have been sleeping in the open air. He's wrapped up in blankets and plastic, with his swollen feet sticking out of cheap sandals on the cold concrete. He has an enormous red puffy abscess in his lower abdomen that he wants to get drained, but he's too fatigued to make it into the clinic. Carl and I hoist him onto the old wheelchair and navigate big puddles and broken sidewalks for a few blocks to get him to the clinic. The clinic doctor applies a local anesthetic and uses a scalpel to make a small incision in a softball-sized abscess on Johnny's abdomen, and she squeezes out what seems like an endless quantity of pus and blood out of the wound. Johnny writhes in pain. The doctor talks to Johnny about his condition. He has had cycles of edema in his legs for months now, and it seems like end-stage cirrhosis from hepatitis C. His prognosis is uncertain. He could die suddenly, or it could be years. He could also overdose more easily now, since his liver might suddenly stop metabolizing opioids. The doctor thinks he ideally needs hospital care to have his condition stabilized, but she recognizes that he likely won't want to go to Tecate, a neighboring city, to do so, since it would mean an expensive and hours-long ride on public transit to get back to Tijuana. He would almost certainly go into excruciating withdrawal without opioids, and there's a good chance he wouldn't be admitted to that hospital anyways. Later, Johnny tells us not to worry. He's going to, quote, get himself to a drug rehab center and get clean as soon as he sorts out a few last things he needs to take care of first. 2 days later, the clinic is open again, and Anna tells me that Johnny died the night before. Because the Tijuana General Hospital was designated as a COVID-19 center, all patients with non-COVID related conditions were required to travel to neighboring cities to access non-pandemic related care. And unfortunately, this had the effect of hospital care becoming virtually inaccessible for a wide swath of low-income people from Tijuana. Disruptions to care for chronic conditions like HIV and hepatitis C were widespread. That said, there were some glimpses of positive structural shifts in the medical treatment of people who inject drugs. For example, a government-funded dedicated shelter and medical treatment facility was opened for people who inject drugs during the pandemic in recognition of the specific subpopulation's particular vulnerability and medical needs. For the first time, medications for opioid use disorder were actually deemed necessary by the governmental healthcare system as an aspect of medical treatment for people who inject drugs, which is a huge advance. However, COVID-19 symptoms were a prerequisite to receive this governmental support, which limited the benefits. But nevertheless, harm reductionists were struck by the remarkable progress of specific unhoused people that received housing and medical care in this period. Long festering abscesses healed, gaunt patients gained weight, outlooks improved, and newfound stability was achieved. So in this sense, facilitated by pandemic-motivated resources, these improvements represented small insights into the potential benefits of a, quote, housing-first model in Tijuana with medications for opioid use disorder integrated. As lockdowns settled over Tijuana, daily life became harder for many people who inject drugs, whose income streams are reliant on face-to-face social interactions. So food, income, and housing insecurity were reported by 73, 69.5, and 29.8% of people who inject drugs, respectively, which are quite high rates. And this reflects the fact that odd jobs became much harder to come by as stores were closed. Panhandling was limited by the presence of fewer people out on the street. And critically, with the border closed to Mexican nationals, many U.S. citizens avoided crossing into Tijuana, even though the Mexican government would allow them to do so. And this limited income from drug and sex tourism from the U.S., which are major sources of funds for people who inject drugs in Tijuana. Here we can see a summary of a vulnerability assessment that we conducted as part of this article. And the main points are simply that the increased difficulty of basic survival disproportionately affected people with other vulnerabilities. For example, having very low income, at baseline, having participated in sex work, and having been deported. In conclusion, the pandemic exacerbated many health risks for people who inject drugs, and yet it also provided glimpses of profound structural change. For example, we saw a 2-month simulation of what life would be like for people who inject drugs in Tijuana if there were no routine policing. It was also a limited experiment in a housing first model in Tijuana with integrated medications for opioid use disorder. Thank you very much for your attention.